with technical announcements. While the participants are still joining, let me remind you that our webinar is going to be held in Russian and in English. Thus, you have this option. You can choose the language channel. To do that, in the bottom of your screen, you can find the globe button, and there you can choose the interpretation channel convenient. Detailed guidelines on choosing the language channel can be found in our chat. Our colleagues have placed it there, so switch to the channel that is convenient, and we start our webinar. So welcome to everyone who is connected, who is connecting to our online event focused on development of the National Strategic Plan. I am Vlada Rabinova. I am Program Manager for TB-EC, and today I'm going to moderate the discussion. Today's webinar is going to be focused on theoretical and practical aspects for NSP development. That theme is especially relevant now, where many countries are in the process of preparing new NSPs or they are completing the preparation process. In the course of the webinar, we will address theoretical aspects for strategic planning and practical aspects linked to the process. We would like to especially focus on the role of the civil society, civil sector, and TB community. Their active engagement at all NSP stages helps not only to engage them in the planning, but also it makes it possible for them to further and directly influence implementation of the strategic document, and that's important for that needs of people affected by TB were reflected in national strategic documents.
Коллеги, вы меня хорошо слышите?
Colleagues, can you hear me?
Да?
Да, слышим.
Отлично, потому что
Yeah, we can hear you.
звуком, пожалуйста, переключитесь.
Some
Возможно,
people
это
have problems
настройки
with
вашего
the sound. Try to switch. Maybe that's about setting of your Zoom application.
Вас хорошо слышно.
Все, отлично. Спасибо вам
We
большое
can
за
hear you
подтверждение.
well.
Тогда,
Okay, thank you for
если
confirming.
я продолжу.
And now
Теперь, после
let me continue.
вопросов,
So
я
after
сообщу
I
информацию
have
от
presented the
исполнительного
stage for
директора
technical
ЕКБ
aspects, I pass the
Юлию
floor
Каланчу
to
для
the
вступительного слова.
CEO
Юлия,
of
тебе слово.
TB-EC, Julia Kalincha, for
Добрый день,
welcoming
дорогие
us.
коллеги, дорогие
Hello,
участники
dear colleagues,
вебинара
dear
от
participants
имени
of
Европейской
the
коалиции
webinar.
TB
On behalf
туберкулеза
of
рада
TB Europe
приветствовать вас
Coalition,
на нашем
I'm
региональном
happy
вебинаре,
to welcome you
посвященном,
at our
как Влада уже
regional
сказала,
webinar
расширению возможностей
on
гражданского
empowering
общества и
civil
сообществ в
society and
подготовке национальных стратегических планов.
communities in preparation of
И
national
этому
strategies.
вебинару предшествовала
This
оффлайн-встреча
webinar
в мае
was
этого года в
preceded by an
Молдове, на
offline
которой мы
meeting
детально
in May
разбирали
this
основы
year in
партнерства
Moldova, where we
между
discussed in detail
национальными
fundamentals of
противотуберкулезными
partnership
программами и
between national
гражданским
TB programs
обществом
and civil
в разработке
society
НСП. И
in
вот сегодня
development of
мы с
NSPs.
радостью делимся с вами
Today, we are pleased
самой
to share with
ценной
you
и
the most
практической, и
valuable
теоретической информацией этой
practical and
встречи.
theoretical
И от имени нашей
information
адвокационной
from
сети
that
я
meeting. On
благодарю
behalf of
Глобальный
our
фонд за
advocacy
финансовую
network, I
поддержку
would like to
региональной
thank the Global
инициативы
Fund for its
и
financial
благодарю
support
наших
of the
уважаемых
regional
спикеров за
initiative
готовность
and our
поделиться своим
distinguished speakers
опытом
for their
и
willingness to
наработками с
share their
более
experience
широким
and
кругом коллег.
insights with a
Поэтому желаем
wide
им
range
продуктивного
of colleagues.
вебинара
So,
и
wishing all of us a productive webinar
активного участия.
and active participation.
Юля, спасибо тебе за напутствующие
Thank
слова.
you, Julia, for this address. And now let me say a couple of words in English because we have here English-speaking participants.
To see you on our webinars. Just technical information regarding the translation. All technical guidelines you can find in the chat, and you can switch on the relevant language for you. So please, if you have any questions, just let us know in the chat. Уважаемые участники, мы переходим
Now,
к
dear participants, we proceed with presentations, and since our webinar is held in 2 languages, we would like to say that screen demonstration is also available in 2 languages, so you can choose between the screens to choose the language that's convenient for you. All technical guidelines are going to be published in the chat, but for that purpose, depending on the version of your Zoom, on your computer or mobile device, on the right, top right, you can choose the viewing settings. So colleagues, let's start screen sharing so that the participants could find the language option that's convenient. So now you can see two screen share options in Russian and in English. So please choose the one that's convenient for you, or in the top panel, you can just choose the language that's convenient. In order to follow in Russian, that's going to be presentation in Russian, презентация на русском. To follow in English, you choose the screen presentation in English. For more detailed instructions, guidelines, you can check the chat box, and now you can switch your screen. Also, to make it convenient for everyone during the meeting, please do not unmute yourselves while the speakers are presenting to avoid background noise. And since we have this specific screen share, try not to press screen share on your screen, not to share your desktop. And also try not to put your cursor on the screen because it may leave the trace and interfere. And I ask our speakers to speak slow so that our interpreters could catch up and interpret all the important information that you share with us. Thank you so much for your understanding, for your support. And now I'm happy to pass the floor to Mikhail Volik, international expert who has extensive experience of preparing NSPs for various countries. Mikhail is going to present an introduction to NSP development, the goals and objectives, the components that the plan is supposed to include, and the steps, the phases that need to be covered to successfully complete NSP. So the floor is yours. Thank you, brother. Thank you for introducing me. And of course, thank you so much for inviting me to participate in this seminar. Initially, the one that we held in Chisinau, and everything, all the proceedings, all the lessons learned, as we mentioned, that's going to form the basis for the next phase. And it's nice to see that people representing the global community are joining, and let's use new technologies to make sure that we expand the geography and the engagement of our participants, and that we speak about the important topic of developing the national strategic plan for TB, what it looks like. On the one hand, that's a very relevant issue now because we are entering the new cycle, especially for the European region countries. The European WHO Bureau calls on the countries to stick to 5-year cycle because it goes in line with the intermediary phases and the final phase for assessments of the global TB strategy that we hope will achieve by 2030. This intermediary goals in line with sustainable development goals set by UN for the humankind. On the other hand, that makes it possible for us to synchronize and the work and see how the progress happens, is ongoing to achieve progress in those countries. But countries make their independent decisions. Other countries may have other cycles, 2 or 3 year cycles. And of course, above all, that depends on the approach to developing the state national policy. Also, it depends on the national budget, the state budget, and the approaches to implement the objectives and the priorities that exist in the healthcare system of each of the countries. And of course, that depends on the national agenda that the governments, the countries, participating countries develop. Let's go to the next slide now. So what we're going to discuss is presented in the new guidelines, relatively new guidelines because the process of drafting strategic plans, TB strategic plans, that has been regulated by WHO for quite a long period of time, but the latest supplemented version, taking into account all the best practices, suggestions from countries, all of that was consolidated by WHO, and in 2022 they issued a new guideline for national strategic planning for TB. You can see the link on the screen. I am not sure that this document has been translated into Russian, but definitely it is available in English and maybe in a number of other languages. So basically you can follow the QR code and check the language version. So this is quite an exhaustive guideline. Let's go to the next slide, and it describes all the stages, why we need to work with the NSP and how to approach that, roles of the participants. But all in all, the main thing that is emphasized is that the process is initiated, moderated, and managed by the state. And that's very important, because above all, that's what the country aspires to, the goals for national development, for healthcare development, and within the strategic area of TB combat. We know that a number of countries try to merge that because happily the TB burden is going down, maybe not as quickly as we would wish it to, and there are reasons for that, but all in all, we can see significant progress compared to what we had previously, and those challenges that we had at the beginning, where SDGs were developed, where the strategy, TB strategy, was developed back in 2014 and 15. 10 years have passed, and we can see significant progress. And the strategies, they are very important because they make it possible to compare, to set the milestones and targets and the objectives that we aspire to achieve, as well as to allocate resources, and further on to see how successful those activities and interventions have been, and whether the policy that is being implemented is successful and results in achieving the goals. And of course, that's the foundational document, and it is very important that in its development and implementation, well, we always start with planning and preparation. So it's important to engage there as many participants as possible, stakeholders, and of course, those representing civil society and the communities above all. Then if we speak about how the process, the development process happens. So we suggest subdividing that into several sub-phases. On the one hand, that's very tentative. However, each of those phases, steps, can be linked with a certain intermediary result that we aspire to achieve. And we see that all in all, that process takes a year or at least 6 months, but maximum one is expected to fit into 12 months, because at the first phase, planning and preparation phase, it is required to do a significant amount of work. This is data collection, data analysis, and there we often engage external experts. So this slide is going to be in English in the Russian version as well, because this is copy-paste from the guidelines. But further on, we will see more details, and that will be in Russian. So we will try to focus on each of these phases, and we will try and see which aspects we need to pay attention to make sure that we provide for participation and full-fledged engagement, meaningful involvement, basically, of the community. And that's the term that's not just a good word combination. That's really something that matters, and this is what we need to undertake.
Next slide, please. So now we will talk about each phase or stage. So we will have preparation and planning, situational analysis, formulation of goals, objectives, strategic interventions, and activities, development of the monitoring and evaluation plan, budgeting, approval, endorsement, dissemination, and resource mobilization. To make sure that at the budgeting stage there are enough resources to implement the NSP, so to make sure that there is technical assistance if needed. Say the last stage is also important for the whole process. And if we talk about preparation and planning, of course, the first step here is establishment of a technical working group. It can be called an expert group, or a different name can be used for this working group, but it means that it is a group of experts who have a certain understanding and expertise, who represent certain sectors, and we will talk about multi-sectoral cooperation and coordination quite a lot. This is what the colleagues from TB Europe Coalition are doing to make sure that there is a multi-sectoral approach in the implementation of relevant strategies and frameworks. So this group will include people responsible for this process. And of course, one of the key roles here belongs to the managers of NSP, representatives of the laboratories working on TB. But also it is important to make sure that representatives of NGOs are part of this working group, people who directly work with those who are vulnerable to tuberculosis, those who are engaged in this process. And those do not have to be organizations working specifically on TB. Those can be NGOs working with vulnerable populations. For instance, there are NGOs who help, for example, homeless people, or there are NGOs assisting people in prisons, or people released from prisons, or work with certain key and vulnerable populations who do not have access to certain medical or social services, or those populations which are defined as underserved, as not covered enough with the resources, or have a higher risk of TB, morbidity and mortality. In case of comorbidities, for example, when TB is combined with HIV. And usually there is some official document to establish such a technical working group. It can be an order or some official letter. And thus, it will start its operation, and the World Health Organization also can support then such a working group. Then next step is development of a work plan for such a technical working group with an adequate budget to make sure that members of such working group can have meetings online or face-to-face. And the final step is approval of the plan and provision of the necessary resources. And we go to the next slide, which is situational analysis. And here we talk about different areas related to tuberculosis and also other epidemical data, epidemiological review. And here also we have a review of the NTP. It can be comprehensive or targeted for certain focused positions. And here it is also very important to make sure that NGOs are engaged in such a review and that they do not only just provide information, but also they participate in the discussion of results and also that they are part of discussion of existing barriers and achievements so that relevant data can be used to plan the following stages. And of course, it is important to have a broad discussion of results of such a review, and also such results can be published and be publicly available. So when we have made a review and we already have some data, when we understand which populations we need to focus on, and at the same time we have some innovation, some treatment regimen, some diagnostic tools, and innovative technologies such as, for example, a digital X-ray or, for example, a rapid diagnostic methods. Now WHO has new recommendations for laboratory diagnostics of TB, including like sequencing, and it is very important for the European region of WHO. And for example, in the European region, drug-resistant tuberculosis is quite a serious issue. And of course, it's not only an issue in the European region and others as well. So when we have all this data, we understand like how we need to prioritize, where we need to focus our resources. Then we define our goals, objectives, priority interventions, epidemiological targets, and coverage goals. And then we define detailed activities. And next slide, please. Of course, it is important to have indicators and M&E, monitoring and evaluation plan. So the next stage is development of such an M&E plan. And here we need to talk about the quality of such data. It is important here to also engage non-governmental organizations, civil society, to understand the progress which is being achieved, and also to make sure that NGOs can actually submit the data. Together with the TB Europe Coalition, we made a review to see how a package of interventions is implemented to ensure adherence to treatment. And we saw that one of the biggest issues in implementing activities in the non-commercial sector is lack of indicators, lack of monitoring and evaluation. And this is a problem for the government also, because there has to be funding, and the funding can only be allocated when there are certain targets which are to be achieved. Next slide, please. So the next one is budgeting. It is self-explanatory. Here we need to prepare a budget. And there are two main approaches. And the WHO recommends to set ambitious goals and include all the activities, all the interventions that are needed to to achieve the goals which are in line with the global strategy. Usually, such a comprehensive plan would require more resources than available in the country and also from the donors. And in such a case, we would have a budget deficit. And this budget deficit is shown as kind of a gap in funding, so that more funding can be requested from the Global Fund, other donors, some maybe like private charities or the government. And there is a different approach because usually the government is not happy to see budget deficit, especially when there is a certain strategy. So usually countries, they want to have budgets with no deficit when there are certain resources available that can be invested in this sphere, but it would mean that the goals, the targets would be less ambitious, but they would be more realistic. And here it is possible to look for some compromise, and usually it is good to also work with some donors so that donor funding is used to implement innovations, a new treatment regimen, new medications, new diagnostic tools. So this is what the compromise can be about, so that there is no deficit in the budget, but if it is possible to accelerate implementation of some innovations, but donor funding can be used. And the next step is approval, endorsement, dissemination, and resource mobilization. So dissemination can be in online and offline formats, and this is needed to make sure that the plan is properly implemented. Here also we need to ensure meaningful engagement of communities and civil society, so that if there are any amendments or changes to the plan, people need to be informed, because possible changes, they can be quite big, and they can influence the work of relevant organizations in the nearest years. And on the next slide, you can see the key components of the NSP. So usually there is a descriptive plan, which is the main document. There are annexes such as operational activities plan, a budget section, monitoring and evaluation plan, technical assistance plan, and there can be additional documents such as action plan for sustainability and transition to domestic financing, human resources plans for the tuberculosis control service, or the national plan for the development of the TB laboratory network. And the next slide is about the roadmap, so that countries would plan a certain timeline. Usually 2 months are enough to prepare all the documents, to have defined strategic directions, activities, indicators, targets, and have an M&A plan. Then 1 month is needed for cost calculation and development of a budget plan, and 2 weeks are needed to have a calendar plan and a technical assistance plan. So all the other documents depend on the priorities of the countries. So that is all from my side. Thank you for your attention. If you have any questions, I will be happy to respond. Thank you so much, Mikhail, for such a good and structured presentation of strategic planning process. It really helps us to better understand the components of the process to develop NSP, and we better understand which steps need to be taken, especially for civil society and communities. And dear participants, we will have a chance to ask questions to our presenters finished after two more presentations from Moldova. And now I would ask you, dear speakers and participants, before we start the next presentations, I would like to ask you to make a joint photo. Please stop screen sharing, and I would ask you to turn your video on so that we can have a photo, a joint photo together. Yeah, please turn your video on. It is good to see all the faces, familiar faces.
Елена, Андрей. Здравствуйте, Алла. Ну, здорово же, когда мы все можем друг друга
That's cool
увидеть.
when all of us can see each other.
Так. Я смотрю, что большинство включили камер.
I see that most people have started their videos.
Коллеги, нам нужно немножко времени, чтобы сфотографировать все
Colleagues, we
страницы. Нас сегодня
need a
много.
little bit of time to take snapshots
Да, и
of
все
all
включили
the
камеры,
pages.
рады
There are
вас
many
видеть
of
всех.
us here, and everyone have started
Большое вам
the
спасибо. Мы
video.
традиционно
Thank
поделимся
you.
фотографиями и
Thank you.
другой
And
информацией о
traditionally, we
вебинарах
will
на
share
ресурсах
the
ТБ. И, конечно,
photos
вы
and other
получите от
information
нас
on
по окончании
TBC
вебинара информационное
resources.
письмо,
And of
которое будет
course,
содержать
after the
ссылки
webinar,
на
you
все
will receive a
презентации, а
follow-up
также на
letter
запись данного
with links to all the
вебинара.
presentations and to the
И скажите,
recording of
пожалуйста,
the
вы
webinar.
успели сделать
So,
фотографии?
colleagues, have you done that?
Отлично. Тогда
Enough
мы
time?
переходим к
Okay.
следующему блоку,
And then we
более
proceed with the
практическому,
next
скажем
item.
так. И
We
я
are going to speak
хотела бы
about more
пригласить
practical aspects,
Валентину
and
Вилк,
I would like to
координатора
invite
национальной
Valentina
туберкулезной
Vilke,
программы
coordinator
Молдова, для
of
того,
the
чтобы
National
она
TB program
поделилась
in
опытом,
Moldova,
как
for her to share the experience of
происходил процесс
how
подготовки
the
NSP-плана и
process
как вы
of NSP
включали в эту
happened
работу
in
представителей
Moldova
гражданского
and how
сектора и
they
сообщества.
engaged
Уважаемая
representatives of
Валентина,
civil
вам
society
слово.
and TB community.
Спасибо
So,
большое,
Valentina, the
Влада.
floor
Добрый день,
is
уважаемые
yours.
коллеги.
Thank you,
В первую
Rada.
очередь,
Hello, dear colleagues.
организаторам
Above all,
большое спасибо
I would
огромное
like to
за
express gratitude
то,
to
что
the
пригласили, а также приятно
organizers. Thank you for
поделиться нашими
inviting
опытами,
me.
потому что
It's so
такой
nice to share
опыт
our
есть у всех
experience, and I
стран.
believe that
Вы знаете,
all
даже
the
когда
countries
начала
have this
готовить, это
experience.
маленькая
But you know,
презентация,
when I
потому
started
что все, что
preparing my
говорил
short
Михаил,
presentation, it's
мы
short
прошли все
because
эти
everything
этапы,
that
потому что без
Mikhail
этого
has mentioned, we
невозможно
covered
запечатать
all of
национальную
those stages,
программу.
because without them, it's
Я начала с
impossible to
названия и
develop the
думаю,
national
ну,
program.
название совместная
And I started with
разработка
the
с
title. I was
неправительственными
thinking about
организациями.
joint
Но
development with
сразу
NGOs,
остановилась, почему,
but
и сейчас
there
объясню на
I
таком
stopped myself, and
слайде,
let me
если можно.
explain why. Let's go to the next slide.
Второй слайд. Почему здесь остановилась? Потому
So
что, в
why I
принципе,
decided
это
to
уже
stop there?
рутина у нас,
Because
когда в
basically
разработке
that's
национальной
already
программы
our
участвуют
routine
все.
where
Это и
development of
неправительственные
national program
организации, и
engages everyone,
правительственные
NGOs
организации,
and
плюс
public officers
различные
and
международные
also
организации,
various
которые работают из
international
Молдовы.
organizations that
Я
work
сейчас
in
не буду
Moldova.
останавливаться на этом
I will
слайде.
not
Я
go
просто
in
специально
detail
поставила, чтобы вы
of this
посмотрели,
slide
какие
now. I just
министерства
wanted to show
участвовали
you
в
which
разработке
ministries
национальной программы.
participated in development of
Министерства,
the national
агентства,
program.
то есть
Ministries,
это в
agencies,
самом деле, когда мы говорим в мафах
and
действий, да, это
basically,
многосекториальное
this is
сотрудничество,
about
это не первый
multi-sectoral
раз сейчас мы
cooperation in
разрабатываем
action.
национальную
And
программу. На
now we are
следующие 5
developing the
лет,
national
но
program for
практически вот
the next
последние
5
две
years.
национальные программы,
But
которые мы
the
внедряли в
recent two
Молдове, они
national
были
programs that we
разработаны
have
совместно
implemented
со
in
всеми. Вот
Moldova,
это
they were developed together
многосекториальное
with all the
сотрудничество,
stakeholders.
оно в первую
Such
очередь выражается в
multi-sectoral
разработке этой
cooperation,
национальной программы.
above all,
Следующий
results in
слайд.
development of
Да,
the
хочу
national
сказать, пока
program.
будет
Let's
переключаться
go to
слайд,
the
что
next one. And
сейчас
meanwhile, let me tell
здесь
you
подключились
that
и мои коллеги
currently
из департамента
we have
координации, все
here my
неправительственные
colleagues from the
организации,
coordination
которые в Молдове.
department and
В
all the
принципе, вся
NGOs
команда,
that work
которая
in Moldova. So
участвует
basically,
сейчас
that's the
в
entire
разработке
team
национальной программы, они
that
подключены
participates
к
in
этому
development of the
вебинару.
national program. All
С
of them have
чего
connected
начиналось, как
to
и
the
говорил
webinar.
Михаил, в
So
первую очередь нам
where we
нужно было
started, as Mikhail
неприкосновенности в
mentioned,
здравоохранении для
above
того,
all,
чтобы
we needed
создать
to
рабочую
have the
группу.
order,
Это
the Minister of Health, to
рабочая
set up
группа
a
была создана
working group.
именно
The
для
working group
разработки национальной
was set
программы,
up
потому
to
что у нас есть еще
develop specifically the national program, because we also have a working group under the National Coordination Board. And let me immediately speak about the challenges that we faced, because now we had 42 people there. Many does not necessarily mean good, because not everybody participates actively. So we need to focus on quality. We need to make sure that these are people who are engaged and committed. We were very happy developing the national program with that all the ministries participated. The Ministry of Education for Social Protection, Ministry of Interior, various agencies, as mentioned. And apart from that, so also NGOs were engaged, which is already normal by default. So for us, it is already routine. This is normal. This is not something specific, because all the decisions, not only for development of the national program, but everything that we discuss, all the decisions that are made in the framework of activities, implementing activities of the national program, we try to do that as transparent as possible, because then it is much easier to implement that. And as I mentioned, the colleagues have joined the webinar and they will confirm that's normal for us. As Mikhail mentioned, we conducted SWOT analysis. The current national program that we're implementing, which challenges we face, because based on that, we decided on our objectives, goals, indicators, what we aspire to. How we did that? We had 12 thematic working meetings, and the colleagues, Rada, Yulia, attended Moldova, and we held those events in the room where basically we had those working meetings. And it's very important to always be open. So apart from the opportunity to be present offline, anyone could connect online. And we invited everyone online, including TB doctors from the field, NGOs that work not only with the focus on TB, but also in other areas, including HIV. And these 12 thematic working sessions, they were needed because we have 7 objectives and we covered each of them. So what we have decided, what we need to address, as Mikhail mentioned, separately, we had a meeting on budget, on indicators. When you work openly, where the process engages all the stakeholders, it makes it much easier to implement that in practice, because every ministry comes with comments. So it's better to hear those comments now, not when we start implementing that. Or when we speak about non-governmental organizations, they know better what they can do. And representatives of national programs. So I believe that we shouldn't force our vision on them, because if you don't discuss aspects, if you do not arrive at a consensus, then that's like power struggle, who's better, who's more correct, and so on and so forth. And the process was not as smooth as it may sound, but we already have the experience. Everything that needs to be discussed is discussed internally within the working group. And when we step out, we already have a clear vision, and there are no questions there. Because it is very unproductive, inefficient when you approach where you attend the national council sessions and NGOs say we're unhappy, or somebody complains about NGOs, that doesn't result in anything good. But of course, NGOs can make a very important contribution into implementation of national programs. But we need to understand, to know what we expect from them and how we expect that. So we undertook the WHO Europe technical review. We had a discussion at the working group session under CCM. That's a different level. There's different other representatives asking questions. And finally, there was a presentation at the CC meeting. And while I was speaking, I mentioned that the latest phase that we completed in late August, that was public hearing. Because, any document that is approved by the government of Moldova is supposed to be subject to public hearing, so we completed that phase as well. Let's go to the next slide. It's very important when we were developing the program. It was important to coordinate that with all the national and international documents. That's very important because all of these indicators that we include in the program, they are supposed to reflect the country realities and the international indicators for, say, TB action plan for the European region that we want to achieve. The more so that if we speak in the context of integration into the European Union, there are additional requirements that must be taken into account. Next slide. I will not go into detail about the program goal and the objective. That's in line with what we have in TB action plan of the European region, and it clearly reflects all of that, but it is adapted to the circumstances in Moldova. Let's now focus on the next slide, because, there's 7 objectives. They are in fine letters. You don't need to go into detail there, but we shared that with the colleagues when they visited Moldova, and that's a number of activities. When you check our national program, that's the active program. It is on the website, and the one that is going to be approved in the format as we developed it. So for every objective, for every task, you will see that NGOs are involved. That's about engagement of other ministries, and that is reflected in the indicators as well. That's important because unless you develop the action plan, you will not include the organizations that are responsible, and then you have no one to demand that from. So there is no one who should be kept accountable. Where we don't have a clear understanding of what we're supposed to achieve, we just stop there. That is why in our action plan, we clearly indicate who's responsible for what and what they aspire to achieve by 2030, the end of 2030. Why I show you these tasks without going into detail, but just pay attention that each of them engages NGOs. And number 6, for example, this is about enhancing the political, strengthening political commitment and the regulatory framework for TB control by promoting people-centered policies, increasing civil society involvement in planning and monitoring. So everything that we discussed is supposed to be reflected in various documents. Only then we will be able to achieve results and the objectives that we set for ourselves. And the last slide, I could speak on and on. That's why let me try and stick to the topic. So the documents that we developed, in order to develop the national program, you need to start with the concept note. It is important to have a clear understanding what that is. Usually the concept note is approved by the state chancellery office. So if they confirm that this concept note goes in line with priorities of the government, of the parliament, with the national policy, then we proceed with the next phase, and this is draft national program. And there, apart from NSP, we have the action plan, as I mentioned, where we clearly indicate which activities are implemented, who does that, and also at the end there are the indicators. But also we have a third document, and we always insist on that, because these indicators for monitoring, evaluation and reporting framework for NSP, they are indicated as a separate annex. It includes all the goals for the next 5 years, indicating the starting point and what we want to achieve, the baseline and what we want to achieve. So in the action plan, in the indicators, so if we now speak about NGOs, we necessarily indicate NGOs there. So implementation of the national program, when we speak about the national program, that sounds as something very extensive. Who's accountable, who is covered? Well, basically this is about all the public and non-governmental organizations, they're responsible. So usually we think about the state, but that's not about the state, that's about all of us, and thus all these indicators need to be within that program. And the budget, as Mikhail mentioned, nobody likes that. That's the most challenging part, because in the budget, everything needs to be reflected, what all the items of the program. So this is the second program already where we do not indicate deficit, because if you indicate deficit, it implies that you can implement a program based on these activities. We believe that all the activities are priorities. So the state needs to think about
the
where they
government
look
needs
for money.
to think like where to find resources to cover all the necessary intervention. And also we need to have a rationale and justification for the NSP. So on 2 or 3 pages, you need to justify why it is important to approve the NSP and what results it will give, because those programs, they are usually big documents, and we need to shortly describe what we want to achieve. And the last slide that I want to share, so that is the visualization of how the work of our working group was happening. You see that some people were joining online, and here you can see representatives of different ministries, NGOs, and on the last photo, you can see that people are raising their hands, and they show that we have reached a consensus, and that was how we worked. So to wrap it up, I want to say that representatives of NSPs, they need to see NGOs as support, as assistance. It is always possible to find a consensus. And also NGOs, they need to hear government officials. And only then, with joint efforts, we can achieve some good results. And I'm very happy to see that in Moldova, we finally were able to come up with this national program representing all the actors. So that is all from my side. Thank you all for listening. If you have any questions, I will be happy to respond. Thank you, Valentina, for your presentation and for showing how NTP engages all the stakeholders in this process, how you cooperated with the civil society. I think that it will be an inspiration for other countries. And as Julia and Mikhail said, we had an face-to-face training in Moldova earlier this year, after which representatives of NTP from other countries said that you have a very good approach building partnerships with the communities, with the civil society, that you engage them at all stages of NSP development. So thank you again for your presentation, and I would like to give the floor to Oksana Rukshinyanu, Executive Director of SMIT, and member of the board at the TB Europe Coalition, to talk about participation of civil society organizations and the TB community in the development of NTP. Thank you, Vlada. After such a presentation from Valentina, it is hard to add anything because it was so informative. But I will also share some information about how we see this process from the side of civil society, because we understand that it is important to ensure participation of CSOs and communities in the development of NPP. So I want to confirm that TB is one of the priorities for Moldova, and this program that we have, it is the seventh program in Moldova, showing that our government has this commitment to eliminate TB at the country level. And according to the national laws and also international regulations, we have our current national TB program. It will be over this year. In the current program, there are three strategic directions to ensure comprehensive services, integrated care, and engagement of civil society and communities. So the current program that we have and the future program has a separate objective. As Valentina mentioned, it is objective 6.5, strengthening participation of CSOs and communities. And it is important to say that the program that we have, the one that will be implemented after it, is focusing on the engagement of communities and civil society, because before that, there was only a separate objective related to it. Now it is comprehensive, and we understand that there is a cascade of services in tuberculosis, and it is important to make sure that civil society and NGOs and communities, they are part of all the parts of the cascade in the process of diagnostics, treatment and care and monitoring. So communities and civil society, they need to be engaged at all the levels. And Valentina said that there is a big contribution of civil society, and it is important to measure it and monitor it. And in Moldova, we have indicators recommended by the WHO, and we have a mechanism of state funding for NGOs. There are two specific indicators relating to services, share of people with the TB, where or proportion of people with TB detected through active screening supported by civil society organizations. That is an indicator tracked annually, and that data is included in the NTP report. And also proportion of people with TB receiving any support from CSOs to improve treatment adherence. So one of the indicators we are still having negotiations about it, but I hope that it will be approved. It is about community-based TB support service package. And it is important to say that in addition to high-level working groups, NGOs, they have a separate platform which they use. Here on the slide, you can see 12 organizations which participate in a TB response. It should be mentioned that in Moldova, we say that TB does not know borders. So if you do not know about Moldova, I can say that we have a part of Moldova Transnistria, which is occupied by the Russian Federation, and we say that TB services should be available to all people in Moldova, despite any political challenges or differences. So we cover also the left bank of Dniester River. We work with the organizations operating on the left bank to make sure that TB is no longer a threat to people in Moldova. And why it is important to engage CSOs and communities. Valentina already mentioned that NGOs and communities, they know about the barriers that hinder TB response, and we always advocate for the importance of relevant interventions. And as Valentina said, there is a concept which you can read and which defines the importance of community engagement. We also know that it is important to have an open dialogue. And from our experience, we know that platforms, they need to be accessible to everyone, and the process should be as transparent as possible. And when we have such an open dialogue and transparency, it is always possible to find a consensus. So in Moldova, we had national consultations with the participation of civil society organizations and TB community, and we have inclusion and participation in the Ministry of Health working group for the development of NSP. And we also talk about reducing stigma. We talk about the community-led monitoring. All those interventions are part of the national TB program for the next period. And also I would like to say that the WHO made an assessment of our current program that we have in Moldova to understand the current situation and define the goals for the next period. So you can see a photo here in the slide. We have Tayahat Hasanova, an expert from the WHO, who had a meeting with the representatives of our platform in Moldova, where we had an important discussion. So as for the lessons learned, so I don't think I will say something new. Of course, here I want to talk about collaboration within the CCM, a technical working group between all the stakeholders, between ministries, international organizations, NGOs, and communities. So such collaboration improves the dialogue, ensures impartial decision-making, and promotes overall transparency of the process. Active participation in development the national program is directly linked to taking into account the interests and rights of the TB community, as well as the sustainability of NGOs. It is important to tell NGOs that if they want to participate in the implementation of the NTP, they need to be engaged in the process of its development, where critical interventions are defined that will be in the plan for the next period. Also, it is important to create equal conditions for all key partners across the country to ensure timely access to information, opportunities for capacity building and participation in policy dialogue, decision-making and implementation. Those should be not just the biggest national organizations, but also local organizations from the regions. Of course, it takes time, as Valentina said, so at least 12 working meetings were needed in addition to others, like other sessions at the CCM level. And also it is important to engage technical partners who play a crucial role. For example, technical assistance from the side of the WHO, it helped us a lot. And also participation of NGOs and the communities does not end with program development. So that is the second thing that we need to keep in mind, that we need to timely monitor the whole process throughout implementation of the program. And another thing is about technical skills, because it is not always easy to ensure this meaningful engagement, as Mikhail said. So it is important to have understanding and engagement in the process related to program development, as well as strengthening our practical ways of participation. So it should all be continuously improved. So it is important for people to build their knowledge, participate at different platforms to build their capacity. And to wrap up, I would like to say that this year the WHO included in its practices this active case finding. So here you see this publication, case studies on engagement of communities and civil society. So if you have any questions, I will be happy to respond.
Thank you, Oksana, for your presentation. Thank you for the great example for other countries of how communities and civil society can be engaged in the process and how important it is to develop partnerships with various stakeholders. And now I would like to stop screen sharing. And now we proceed with Q&A session. Please raise your hand and our speakers will be happy to answer your questions.
Да, Влада, я бы хотела обратить внимание, что у нас
Vlada, I would like to emphasize that in the chat box we have a question from Roderick. So, Roderick, maybe you would like to ask this question by unmuting yourself. You could ask this question to the speakers, or we can read it out. So if you wish, Roderick, you are welcome to unmute and ask the question.
Если нет, давайте тогда я
Otherwise,
адресую. Сейчас я еще раз посмотрю. Родрик, вы хотите
check the
включить
question.
микрофон?
So, Roderick, are you there? Would you like to speak?
Хорошо, тогда я адресую вопрос из чата.
Okay, then let me read it aloud. I believe that Mikhail...
Извините.
Sorry, I stopped my video. So, I understand the question was addressed to you because it was asked after your presentation. Is there a global regional document that highlights key priorities and issues that communities could advocate for inclusion in TB NSP? Thank you. That's really a good question. And basically, there are a lot of documents, but currently there is not a single strategy that would be issued by an international agency without that. The entire global strategy, TB strategy, that's a huge document where they separately emphasize the role of the communities and civil society. In addition to that, international partnership, Stop TB partnership, that's also one of UN agencies that published the global action plan for the period till 2030. And there is a significant portion of information on how advocacy is held, what strategic activities are implemented, what kind of innovations, in particular, this is about engagement of communities, to planning, to research agenda. This is what the European Coalition is supporting actively. We are working to set up committees, ethics committees engaging representatives of the community so that all the research engage the communities. There is also the Global Fund, and the Global Fund has so-called technical briefs and special documents that are focused on best practices for community engagement and how it works. And of course, for many countries that are recipients, beneficiaries of Global Fund, that's an important document that they can be guided by and that can be used in their work. And of course, again, the document that I presented, WHO recommendations on development of the National Strategic Plan. And of course, I could not cover all of that with my 14 slides, but I recommend that you go into detail on that because that is basically a step-by-step guideline for every TB activist, what to do, what to pay attention to. And of course, communities can always raise the aspect of equal and fair access, integration of TB care in healthcare system, the need for financing, supporting monitoring, community-based monitoring, the necessity to engage social determinants of health, and the need for transparent mechanisms to assess progress. These are important aspects that for every activist need to apply. And if you have other suggestions, I know that TBC has a number of publications that could be just directly implemented for a significant number of organizations that could be helpful. Thank you, Mikhail, and colleagues. Let me pay your attention to the fact that now you have this unique opportunity to ask your questions to experts, both theoretical questions and practical questions. Mikhail is a WHO consultant advisor. He works with many countries drafting NSP. He has practical experience. He can help out in many aspects. And of course, our colleagues from Moldova, Oksana, Valentina, they are reaching the final steps for NSP approval. You see that this is the 7th program that they approve jointly, so you can come up with any questions. And while the participants are thinking about their questions, I would like to address a question to Valentina and Oksana. It is a bit similar, but the emphasis is a bit different. So, dear Valentina, you spoke about engagement of various sectors, and that's very interesting experience. Could you tell us what are the barriers, obstacles for engagement of ministries have you encountered, and how did you overcome that? Because maybe these ministries were not that eager to deal with TB, because we know that every ministry has its own area of work. So how did you engage them to work on NSP, and how did you manage to include them in NSP? And also to Oksana, whether you, as the communities and civil society sector, if you conduct any additional work with the ministries apart from joint participation in NSP working groups. Thank you so much. Yeah, let me start. And Yulia, thank you so much. That's a good question, because if you saw where we started, as Mikhail mentioned first, there is the order of the Minister of Health, where this working group is set up. But how it is set up? Well, first of all, the ministry sends the request to all the ministries, what kind of representatives, which representatives are going to participate in those working groups. And the same goes to NGOs. So NGOs decide on their own who's going to be, well, everyone who participated, they are all here in the webinar. Only Svetlana is somewhere absent, but she is in some penitentiary institutions today. But Alla, Marina, Oksana, Pavel, everyone is here. So how we participated? It was not that scary because I believe that it is important to adequately organize the first working group to set the tasks and the highlights so that people realized why they come. Because we have two programs that were developed in parallel, TB program and for hepatitis. And by the way, they were not that active. If we speak about the Ministry of Justice, there is the Agency for National Institutions, and they always participate in all kinds of our where we organize them. The Ministry of Interior, when their position changed, well, we had projects even before the COVID pandemic with IOM, and there we engaged the Ministry of Interior because they deal with refugees. So there we discussed all of those documents, and basically the problem of TB is there, and we were very surprised that the Ministry of Education were very active. They came up with their suggestions. They suggested to include into their curriculum for schools such topics, and they suggested their own indicators. The Ministry of Labor and Social Protection, they were very active, they were good, because when we were speaking about catastrophic costs, we said that it is important to finance that not only for TB patients, but also for the families, and they didn't say, we cannot allocate that. They just suggested the mechanism that we could use to assess how vulnerable socially they are and if they need help. After every program, it is improved further. So where we develop the next program, it's going to be even better. But this is in order to have this cooperation, we need to work on the permanent basis, engage them. If we speak about the Ministry of Labor and Social Protection, NGOs have very good experience where together with their representatives and social workers, we developed a management process for children affected by TB. And this is included into the order to implement the national program. It is not that we do that today and we're going to resolve that problem here and now. In order to develop this cooperation, that's a long process of engagement into our activities. But there are those ministries that are not going to work or to engage. For example, the Ministry of Agriculture. They are ones where we had Mycobacteria bovis, and there was TB among the cattle population. When that was a problem for Moldova, they could be engaged. But now it's no longer a pressing issue, and they have no wish to engage and to participate in activities. But I'm happy that this main ministries, they work with us on a regular basis, and Oksana could share the experience with the Ministry of Labor and Social Protection. So this is what we achieve in the course of our work. It doesn't happen overnight. And have there been any problems? I wonder how you managed to overcome those. Well, this time when developing the national program, we did not encounter problems. Basically, there are no problems. That's not a problem, that's a challenge that can be addressed. For example, the Ministry of Labor said that we are not going to allocate financial resources for families affected by TB. So we can insist, but according to legislation, that's not expected, but there are other mechanisms that could be kind of connected, activated to address that, because not all TB patients have some additional needs. So if someone has TB, it doesn't mean that they are necessarily socially vulnerable. Those who are vulnerable, it is possible to provide this assistance. So that happened before, and that they said this is not a relevant issue for them. But frankly speaking, we rather had more kind of obstacles from healthcare facilities than ministries. Right, because you've been engaging them for a long period of time, they understand the issue, and thus there is no opposition. Oksana, can you share? Yes, thank you, Yulia, for your question. Right, to open it up a little bit regarding social support, our legislation is quite favorable for everyone. Based on social vulnerability, everyone can apply for certain support, including families affected by TB. We had a separate meeting with social workers, by the way, and we raised this issue. Why? Based on the fact that someone has TB, they do not allocate social like social protection opportunities, and access for social guarantees is not provided based on condition. It is based on social vulnerability, and if you allocate based on disease, on a condition, then you discriminate other conditions that we could speak about, diabetes and so on and so forth. So that's not adequate. That is why we apply the approach of social vulnerability. And there is this questionnaire that is developed, and everyone gets social support without any problem. Regarding social support by the national insurance companies throughout the treatment, we have the nutrition voucher that is allocated based on social cards. And again, we wouldn't say that patients who undergo treatment, that they have forgotten about the state and the state doesn't allocate any assistance for their nutrition or whatever. That has been done throughout the outpatient treatment, and that's financed by the state, the national insurance company. On average, they allocate $80 per month, provided there is adherence to treatment. So that's not just some allowance by the state, that's in order to improve.
If we talk about some practical steps, I think we were smart enough to include in our proposal to the Global Fund interventions aimed at building multi-sectoral cooperation at the community level. So here I talk about the regional and municipal level, and Valentina will confirm that we call it TB Rep point 3. So every month at the district levels, we have round table discussions, and we invite, in addition to medical workers and social workers, law enforcers, police, and we prepare draft plans at the district level. Then there it is reviewed and some additions are made. But the main thing is that people at the district level understand that nobody imposes this plan on them from the country level, from the national level, because there is first this national program, but also there are local programs which are adapted and adjusted to the local context. And it is all approved and coordinated. And since last year, we already had 17 such round tables where we prepare such individualized local plans to make sure that all people at the district, at the local level, at the village level, so all people are engaged in the development of such plans so that they understand why it is important to do the costing, to know the resources, because many people, they at the local level, they do not do the so-called tracking, so they do not understand how much they invest, what their costs are. And when at the end of the year, from the national level, they are asked, so how much resources were invested by the local authorities, they just put zero because they do not do such calculations. However, it is important to show all the efforts at different levels. So, in fact, there are resources and there are more contributions than actually are shown at the national level. Thank you, Oksana. Pavel, I see that you are raising your hand. Would you like to add to what Oksana said, or do you have a separate question? Because I thought here has a questions in the chat I wanted to ask. I wanted to add to this issue about the social sphere. We have partnerships with the hotline of the social policy ministry, and when people call to the hotline of the ministry, and if this question is related to TB, automatically such issues are referred to us so that we would find a solution. So in practice, it allows to improve the consolidated approach. Thank you. Thank you for this addition. Aizat, would you like to ask your question? Maybe unmute yourself because Oksana touched upon this question a bit. So, Oksana, Valentina, could you please respond quickly? Yeah, thank you for this question. So the question is around a long list of NGOs in Moldova which participate in TB response. So how do you coordinate all this work? Yes, well, the list of the NGOs is long, but we want to have even more. And as Oksana said, there is this platform, TB Plus, to coordinate NGOs participating in TB response. So we have a global fund project, we cooperate with the insurance company, and before we start a new year, what we usually do, we engage NGOs in screening. We engage them in the efforts to improve adherence to treatment. And it is all regulated by orders of the Ministry of Health, where we specify where NGOs are working, which NGO is working in which district, who their beneficiaries are, what their indicators are. So it is quite a big document that we prepare, but it is very detailed. Even there is information about the consent of people who participate in screening. So it is all kind of regulated and coordinated. For example, we have this insurance company, and they say that we need to understand their priorities for the prevention. And when I go to this meeting, I talk to our NGOs and I tell them, you need to define what you would like to do and in which places, in which districts, so where you plan to work. So I do not make my own decision. I just represent NTP, and my colleagues and I, we just decide what areas need to be covered. For example, we see that in certain regions, TB mortality is growing among children, for example, and we decided it is a priority. And the second thing is the validation of data. So everything that is done by NGOs is coordinated by our department. So for the insurance company and for the global fund, we validate. We see that really this NGO, for example, had screening among this number of people and they identified certain number of cases of TB. So we coordinate all those activities together. This is not done just separately by each stakeholder. And I see that it gives good results because we work in the places where it is most needed and we specify in which areas we need engagement and support of NGOs. So I can talk a lot about it because all those things, they work. But it is important to go to this result step by step. It is not so easy to change the mentality of doctors. For example, our TB doctors, they are happy to cooperate with the NGOs because, for example, if they have this experience of cooperation, they know that NGOs, they offer support and assistance. However, for example, if there are some new districts, new regions that we start to cover, they maybe are not aware of the possibilities of such partnerships. They say, will NGOs be teaching me? It is such an interesting discussion, dear colleagues. I see that we have some delays in terms of timing, but we have an interesting presentation which will be the basis for the development of NSP and for your work at the national level. So, Vlada, I give the floor to you. And yes, colleagues, we will have a recording because there was a question about the recording in the chat. So I would like to give the floor to Mikhail. Again, he will have a practical presentation about analysis of the TB care cascade from the people-centered approach. So now we will show the screen to you and we will show you how we can use epidemiological data to develop an NSP. Thank you, Vlad. I would like to thank all the participants for your questions. Your questions are really interesting. And I would like to talk a little bit about the approach to strategic planning. Of course, it is not possible to imagine how we could do without a cascade of care services. So this is what TB organizations actively use. So because we don't have much time, I will be skipping some slides. So this component is part of the second item, situational analysis. But it is good to repeat this exercise regularly. For example, it can be done on an annual basis when there is a review of the plan. And of course, we keep in mind the guidelines that we have, and I have included references to the documents I have mentioned. I'm sure that these documents will be very helpful. I'm sure that you will find a lot of data and information that you can use in your work. So that is WHO guidelines, people-centered framework for TB program planning and prioritization. So this is a publication of from 2019, but it is still relevant and good. So here I wanted to show you the global and national strategies and how they are all interlinked. Here, of course, we talk about WHO NTB strategy, about the goal number 3, good health and well-being. And of course, there are strategies of STOP-TB partnership at the global fund. So all those like targets and strategies are interrelated. And we know that there are mid-term goals and target indicators. So there are goals for 2025, 2030, 2035. So we see that, for example, we would like to have 95% reduction in TB mortality compared to 2015 level in 2035. Also, we have indicators on reduction in TB incidence and the burden for families. And when we talk about strategic plans to end TB, of course, we keep in mind the document ratified by the countries at the World Health Assembly and other international platforms. So here we talk about certain core elements or pillars. The first one is integrated people-centered care and prevention. Here we have early diagnosis of TB, including access to rapid diagnostic tests, systematic screening of contacts and high-risk groups. So this is what is people-centered care is about. And also there are other components which you could see on the slide. And that is a good document prepared by PASS Center with support of TB-REP 2.0 project. And so it was supported by the WHO and WHO Europe on the TB approach based on the needs of the patients. And here I wanted to show that the TB care cascade. So when people receive care, we know that there are some factors defining access of people to care, barriers, challenges, because sometimes there are certain issues which are more priority issues for the person. And first, people want to address them before they start treating their tuberculosis, and it leads to people lost to follow up. That is why we're losing people and it leads to the gaps. And we see that some people are lost at some point of this care cascade, so that it prevents us from providing other care. We can see all the stages here, and people are lost at each of the stages. And this cascade shows visually people who are lost. And starting from 2019 or 2020, we have active discussions, and there are many publications. And we use such cascades when we work with countries.
And here, the WHO framework suggests several stages, more detailed stages for various countries. They may mean different things. In the European region, there is quite a powerful structure, and this is the TB service and providing TB care. And here it's hard to imagine that someone who is diagnosed with TB, that they don't get registered in the healthcare system. But globally, there are countries where TB is diagnosed and the information doesn't go to the system, even though there was suspicion or diagnosis of TB. Further on, people don't get care. But there are also other challenges: untimely or inadequate diagnosis or application of some measures that WHO tries to recommend. Quick molecular diagnosis, quick onset of training, short training regimen, 4 months treatment of TB. So all of that shows where and how we assess providing TB assistance. And each indicator, on the one hand, speaks about that we have this problem in the field of providing care and medical care, health care, but also there are also those aspects where the community can be involved so that this program reached everyone who needs that, and that it were more efficient. Then we have an entire exercise, a module that we usually implement. We even implemented an e-module of training on how we look for the information, how we develop, create the cascade of care, and how we try to rely on the data available as well as data on the national or subnational levels, but we don't have time to cover all of those indicators in more detail. However, we know how the targets are developed. We know which indicators are available from national and regional plans. In the European region, we rely on the action plan for the European region to fight TB for the period till 2030, and there are clear indicators. Regional and national plans could be more ambitious. They cannot be less ambitious than the global strategy, but they can be more ambitious. In the European region, for example, the target is achieving 85 efficiency of treatment of MDR TB by 2030. So far, as far as I know, no other region has this goal target, and for our region, this is important, and most importantly, this is achievable, feasible now, and countries supported that when they voted for that document at the regional level. Next slide. Here we speak about the data sources. Of course, this is WHO Global Tuberculosis Report that is published on the annual basis, and there is this country profile for TB. And I am ready to show you how we consider this data, how they can be analyzed, and what they tell us. And there are also other elements and data dashboards for TB Partnership Coalition and various projects in the countries that use cascade models. There are data panels that are developed in collaboration. These resources are very helpful, and of course it would be very good if they were open and transparent for public discussion. And here we should express gratitude to NTP Moldova, everyone who works in Moldova. That's a great example of how they make this data public, and of course that's about more responsible and fair participation, and as a result the programs are planned and implemented in a more efficient way. Here we intended to make this practical assignment. We have a certain list that we could cover to see how these documents are considered, and the main ones is the estimated number of people with TB. This is an absolute figure, but this is estimation, so it's important to take it into account that this is not the number of registered cases. But that always raises a lot of discussions, but that's an important indicator, because we understand that unfortunately in any system we have the issue of the failure to document the number of TB cases, but the size of the issue and how fair this estimation is, that's something that makes countries act more actively, because if lots of cases are lost, that means that more resources are needed for screening programs. And by the way, it was interesting to note when Valentina was presenting that we see a lower budget for all the programs, and that means that the country estimates that there will be fewer cases, fewer people who need treatment. That's logical, but that means that the fewer people fall ill, more efforts need to be involved to detect those cases, and this has been thought through, and hopefully it will be implemented efficiently, and all of that is reflected in a range of documents. The next indicator This is the registered number of people with TB, absolute number, and the ratio of the absolute number and the estimated number gives us the such indicator as we refer to as treatment average. So it indicates to what extent we can cover the number of people who need TB care. We aspire and that it is at least 90%, but that's hard to do that, especially against the background of reduction of the general burden of TB. Another indicator that's important, that's the number of people who were registered with TB symptoms and who received rapid molecular diagnostic testing, especially at the moment of diagnosing, because that gives us fast result and immediately determines the sensitivity range so that we could start treatment and adequately pick up the treatments considering susceptibility and of the patient. And also that makes it possible to reduce the time of waiting where the disease was detected for the first time or the symptoms were detected till the onset of the disease. So where we know those results already, we consider another important indicator, and that is the percentage of successful treatment outcomes, which includes those who were treated, who completed the course of treatment. These are two different cohorts, so we consider that for different cohorts, for new cases, for repeatedly treated patients, for patients with comorbidity, with HIV, with MDR, non-MDR, extensive or narrow. So these cohorts can be approached differently, and in every cohort there will be a bit different approach to treatment. And of course, the more difficult it is to treat, the lower the efficiency. That also shows this lost figures. So that indicates the losses in the cascade of care at the final stage. And so here we can speak about the stages of the cascade where most cases are lost, and also we can see which data we need in order to understand better where and why those losses happen, and what could be done about that. And here, when we speak about the cascade of care, we understand that there is a number of stages in the cascade where mostly depends on what happens in the healthcare facility, and this is determined by the doctor, TB specialist. This is about coming for help and laboratory diagnosis, the beginning of treatment, intensive phase of treatment. That is what takes time and efforts of medical staff, but not only. Before someone gets diagnosis, it is also important to conduct outreach among vulnerable populations and refer for diagnosis, rehabilitation, re-socialization, work with the environment. All of that requires a significant greater engagement of the staff at the healthcare facility, and that influences the testing of contacts, palliative care, and if there are comorbidities, these are important factors need for treatment, overcoming stigma, and also work with those who are lost to follow up at the beginning of treatment and in the course of treatment. At all of those phases, engagement of NGOs and civil society is very important. And today we speak about the global level, and we speak not only about the cascade where the TB is diagnosed, but also we speak about prevention, because there is a significant shift in our understanding where the burden of TB goes down. We focus even more on preventive treatment, on screening programs, and there it is important to know that. And there it is also possible to create this sort of a cascade, because there we need to know the number of individuals in the most vulnerable target group. We need to conduct assessments of that group. And with the support of Stop TB partnership in many countries, in our region in particular, these estimations were conducted with Pars Socialis Center, which makes it possible to detect the most vulnerable groups and detect those people who we need to work with. And based on that estimated number, how many could be were reached and covered, how many were screened, positive or negative tests, those who had positive tests, they already enter the treatment cascade. So where the diagnosis was, where the result was negative, we start preventive treatment, and we expect that it will be implemented fully. And there we may also lose those cases. So that is why we speak about that countries need to include these spaces into their strategic planning. And apart from numerical quantitative estimations, we also speak about time lags that may arise, because one thing is detecting and referring for treatments and completing treatments in a timely manner, but also those who develop TB may first look for assistance for care for a long period of time, try to get it for various reasons, but never reach the point where they would be diagnosed with TB or preventive treatment is prescribed. So there we speak about other concepts: delay in care seeking, where someone develops TB symptoms, but they never reach, or it takes time to reach the moment of diagnosis, collecting biomaterial and the biomolecular diagnosis is held. Then diagnostic delay and delay before treatment initiation, when the diagnosis is set, but the treatment was not initiated, or it was initiated in an inadequate way because not rapid methods were used, and it took a lot of time to confirm MDR-TB diagnosis. So the treatment regimen needs to be revised. And of course, the overall delay from care seeking to treatment. Several studies have been conducted in different countries where we see that these delays may be quite significant, even though these processes could be held very quickly. And the very idea of rapid molecular diagnosis implies that in 2 hours we can get the result and start the treatment.
Wow, that is all from my side. As for the practical exercise, I do not know, Vlada and the organizers, if we have time for that. Mikhail, thank you for your presentation and for your suggestion. Well, we have had a delay for 15 minutes already. So if we have any questions, let us maybe offer to ask one question now, and all the other questions can be asked in writing later, not to keep our speakers and interpreters. Well, I think that if there are no questions, maybe we could quickly have a look at the country profile, just as a practical exercise. So, colleagues, do you have any questions about Mikhail's presentation? I have a question. Aizat, yes, please. Thank you, Mikhail. It was an interesting presentation. So I am curious about the slide where you were showing the cascade of TB care. So how do you make calculations for step 6, post-TB? So how do you calculate the number for this part of the cascade? I do not know how it is in other countries, but we do not have a post-TB follow-up in our country. So how did you calculate that? Thank you, Aiza. That is a good question. So not everybody does that. I do not do calculations myself. I just use available publications, but this is actually a percentage of relapses, because if there are relapses, it means that there were some issues with care. If it's like 6% relapses, that's one thing. If it's around 15%, that is a different thing. And it shows like how the cascade is working. So we do not only look at the finalization of treatment, completion of treatment, but also we recommend to have a follow up for patients for several months at least. So this is what we did at this workshop that was mentioned before. So many people said that it is an interesting indicator and they wanted to maybe use it. And maybe I can briefly present what I wanted to show you. So that is the website of the World Health Organization. Here there is global program on tuberculosis and lung health. So this title has changed a bit. So it includes also other lung conditions and their diseases. And here it is possible to access TB data and in particular country profiles. So we can open country profiles. The first country is Afghanistan. So we will not look for other countries, so we can just check this profile. So there is total TB incidence as of 2023. So there is a number 75,000, but you can see that that is an interval actually. So the minimum number is 47,000 and the maximum is 109,000. So within this interval, and everything that goes within this range is good for the program. So also there are TB case notifications. Here, people diagnosed with a new or relapsed case of TB in 2023. You can see that it's around 50,000. So it looks like we are within the interval, but if we look at the total number, so the total is 75 and that is 49. That's not a lot. We understand that in such a country as Afghanistan, there can be certain issues, and here also they calculate TB treatment coverage. So notified new and relapsed cases divided by estimated incidence. So here we have 66% from 46 to 110. So probably there is space here for more efforts. Another indicator that we can find is the percentage of tested with the rapid diagnostics at time of diagnosis. So the number that we see here is 45%, and we understand that it is quite low. We want to have at least 90% coverage. We understand that it is related to logistics, infrastructure, and other problems, because it means that there should be gene expert machines at certain venues in certain areas. So there should be a laboratory network, a transport infrastructure. So without those things, of course, it is very difficult. But it means that more than half, more than 50% of people, they do not get rapid diagnostics. So when they start treatment, we cannot be sure that it is within the sensitivity range. And we can also see here, for example, treatment success rate and cohort size. So among your relapsed cases of TB started on treatment for TB 2022, success is 95%. So we can see, for example, among people living with HIV, it's 83%, MDR or RR TB 68%. So here we need to be a bit skeptical, of course, when we see all those numbers. And we need to also see the number of relapses registered, because if we see that how many people were diagnosed with new relapsed cases of TB, it's 50,000. So we can also check how many relapses there were, but so we need to have a look at all the data tables here, at all the estimates, and then we can use different methods for visualization of this data. So that is just briefly what I wanted to show you. Thank you so much, Mikhail. Thank you so much, dear participants, for your questions, for your attention. So we took a bit more time today, but we want to say thank you to all the participants, because most of you are still with us. So we would like to thank our speakers for their expertise, for their experience that they shared with us. And also we want to thank our interpreters who allowed us to understand each other. If you missed any presentation, any speech, we will share the recording with you. We will send it by email. We will be sharing also the materials of this webinar. You will get everything.
Коллеги, у Влады пропадает интернет. Мы будем рады отправить вам все материалы, которые
colleagues,
были
as the
сегодня
Vlada
презентованы. А также,
said,
если
we will be
у вас
sharing all the
остались вопросы,
materials,
которые вы бы хотели
all the slides
адресовать нашим
presented. And
многоуважаемым
if you
спикерам,
still
вы
have
можете
some
написать
questions to
это
our
письменно нам,
speakers,
и мы
please write
попросим
these
наших спикеров его
questions to
адресовать. Поэтому
us, and
спасибо
we
вам огромное.
will
Еще раз,
get
я
in
думаю,
touch
что
with
эта
the
информация
speakers so
была
that they can
полезной,
get back
учитывая,
to
что
you.
все страны
So
сейчас
thank you
будут
for your
готовиться к
attention. I
подписанию
hope
нового
that
NSP.
this
Я думаю,
information was
что вы сможете
helpful,
применить
because the
полученные
countries
знания
are
на практике. Поэтому
preparing for
спасибо вам еще
developing
раз
a new
большое.
NSP. So I hope
Хорошего
that you will
дня,
put this knowledge into
мира вам
practice. So
и
thank you
до
again.
скорых
Have a
встреч.
good day.
До
Have a
свидания.
peaceful day, and see you soon. Goodbye.
Да, всем. До
Спасибо.
свидания.
Thank you.
Спасибо,
Goodbye.
Валентина, Оксана, Михаил.
Спасибо.
Спасибо.
Thank you, Valentina, Oksana,
До свидания.
Mikhail.
До свидания, коллеги.